বাড়িতে কেউ আছেন? আদাব বুদি, কেমন আছেন? আমি ভালো আছি। আমি বাসাইল উপজেলা পরিবার পরিকল্পনা অফিস থেকে আসছি। আমার নাম খন্দকার কামরুন নাহার। জনসংখ্যা নিবন্ধনের কাজ চলতেছে। এই ট্যাবলেট দিচ্ছে আমাদের সরকার। আমি আপনাদের পরিবারের সকল তথ্য এটার মধ্যে উঠিয়ে নিয়ে যাব। আমি পরিবার কল্যাণ সহকারী হিসাবে কাজ করছি ৭ বছর যাবৎ। জনসংখ্যা নিবন্ধন করতে ট্যাবের কাজ প্রথম অবস্থায় আমার কাছে কঠিনই লাগতো। এটা সম্বন্ধে তো আমার কোনো জ্ঞান ছিল না। তারপরে ট্রেনিংয়ের পরে আমি এটা সম্বন্ধে আমার ধারণা জন্মেছে এবং আমি এটা খুব সুন্দরভাবে করতে পারি। আর এই ট্যাবটা আমার কাজকে সহজ করেছে।
Population registration system is we call it a foundation of routine health information system. Basically, what we are doing is registering all the population using health workers who go from house to house, visit households, collect information about the household. That means all the members of the household are registered. They use tablets and they collect personal information and also some other information like their socioeconomic status, and this goes into a database which is maintained in Dhaka in a central location.
The population registration is important, and having it digitalized is important for Bangladesh, for the region, and also for the world. First, for Bangladesh, it helps us collect data at the community level, and it gives us a basis upon which we can do other interventions. And we can also analyze data by specific region, by specific population, and the data is then complete. For the region, it's important because there are many other countries like Bangladesh who can learn how we have collected that data and how we can improve on it. For the world, it's important because we share information with everybody, and when anybody has this kind of systems, data sharing becomes much more important, and we can tackle many of the outbreaks we have globally and regionally.
Our Honorable Prime Minister wants to grow Bangladesh as digital Bangladesh. So, if we want to establish our Bangladesh, digital Bangladesh, online data supply and connection is everything is necessary. These RHIS activities, that is population registration through online, it will be very helpful for us.
The population registration system will benefit the ministries in many ways. This will help us to understand the size of the populations and their geographic distribution, and also the demographic situations of the people living in the country. Second, this will help us to track individual health conditions and also to understand their trend.
Routine health information system, or RHIS, has a very elaborate vision in terms of provision of services and also capturing services that is being done, performed by our health workers who work within the government. We have seen that they are doing more than 12 households in a day, and this translates into 50 to 60 persons in a day. And they have used their devices well. All the data collected by them offline and uploaded to a central server within 24 hours at regular intervals, and all the data are centrally stored and usable immediately and can be analyzed.
This system already changed our work style. Before, our field workers went door to door with a large size of register, and after completion they do not need to take this large size of register, and they show this tablet to their colleagues, and they feel proud that I am using a latest technology.
Our health workers already maintaining these records, but it will be electronic, so the intelligent solutions will be used to provide them with the list so they can see and they can also plan what kind of services they need.
Population registration is very essential in respect of decision making, like for budgeting, for distribution of medicine and medical and surgical requirements, and so on.
And one of the big advantages is that with paper-based systems, you basically can hide under piles of paper. Whereas with electronic systems, it's immensely searchable. So everyone is accountable, everything gets to be seen, can be seen anytime you want to. And the data is generated primarily to help the provider to provide better services. He or she can do a better job, and we can hold him or her accountable. For the managers, it is data in your face information so that they can't run away from it.
The population registration system using digital tablets will be a good lessons from other developing countries, because Bangladesh is a developing country and is a poor setting. In Bangladesh, actually we are using digital tablets, the mobile technology, these are low cost. Second, we have got problems of electricity, we have problems of internet connectivity and speed, and at the same time skill of the health workers. So the design of the system has been done keeping all those factors in mind. So if this is become successful, and virtually we are confident that this is going to be successful. So this will be a good lessons for other developing countries, and I think in low cost they will be able to implement in their own situations, and the same benefits will be able to achieve in Bangladesh, they will also be able to achieve in their own countries.